want to say in the final minutes is have you give us the floor about neurocognitive decline, cognitive decline, dementia, its connections to your research.
Well, thank you for that. So we ran, this was a dietary supplement study. So we didn't alter anyone's drug use, diet, physical activity, socialization. We were working with this allopolysaccharide formula that it was based on my mentor and friend, Dr. Reg McDaniel, and his experience up to that point. And I met him about 20 years ago. He's actually in your neck of the woods in the Dallas area.
Okay.
But we enrolled people with moderate to severe severity of Alzheimer's disease, which, as you know, that's the group Big Pharma cares nothing about studying. And we put them on this formula for 12 months. And we assessed their cognitive function at baseline, 3, 6, 9, and 12 months. We drew blood at baseline in 12 months.
Mm-hmm.
And Dr. McCullough, we showed something in this study that literally is unparalleled in the scientific literature. We showed clinically and statistically significant improvement in cognitive function according to the ADAS-Cog, which is the gold standard for assessing cognition, especially in people with dementia at 9 and 12 months. That's unheard of.
This is astounding. Now, what's the product again, or what's the strategy?
So it was a dietary supplement that actually, unfortunately, and if you want to have another conversation to go in more depth about this, I'd love to, but it actually was the beginning of the end of my full-time research career, because I made this discovery. I shouldn't say we, my colleagues and I tried to get more funding from NIH and Alzheimer's Association, which, oh, by the way, the only way we were able to run the study was due to the generosity of this one family that had lost 4 family members to Alzheimer's. And after 4 attempts, I got that much in response.
Really?
And I said, why am I going to continue banging my head against the wall trying to get these folks to acknowledge what we've shown here that can actually help people with this terrible disease? And so I had to leave academics. I went into business based on this formulation that we now call daily brain care. But it was going from literally on cloud 9 to not even in the valley, but under the valley. We also showed improvements in the CD4 to CD8 ratio. We showed reductions in TNF alpha and VEGF. And we showed an improvement in the CD14 cells of 286% over that 12-month period. It was published in the Journal of Alzheimer's Disease. We've actually published 4 articles from that study. It was the one and only time in my career where Dr. Perry, and he's still the editor of that journal, he called me after we submitted the paper. And he goes, "Wow, Dr. Lewis, this paper is amazing." He goes, as soon as we get the reviews back, I'm going to publish this paper immediately. Like, this is so exciting. And so I have a hole in my heart where I could not get more funding to extend this line of research, because it's potentially so valuable. And as you and I have been discussing all of these nuances and things about diet today, it's so much easier when you can just give somebody a supplement.
Yeah.
And not to say that you can supplement your way to good health. I'm not saying that at all. But in this case, with something as tragic and as deadly as Alzheimer's disease, I mean, we have such an amazing tool that can help people. And that's what I've been doing. I mean, I still teach students. I still lecture at grand rounds. I still do things at the university, but I didn't have a mechanism to keep supporting myself through research money, because basically I couldn't get any of these so-called experts to help me. And it was just really tragic that I had to basically take a right turn in my career and do something else because I couldn't continue getting funding for it.
Well, it's one of the great tragedies of our federal funding mechanisms. It's typically science for science sake, and as soon as there's a commercial interest, they wash their hands, and then it kind of moves into the commercial space. The vast majority of research, a lot of people don't realize this, is actually funded by commercial companies, not by the NIH or other federal agencies. So the name of the product again is it Daily Brain Care?
Daily Brain Care under the Dr. Lewis Nutrition brand.
Dr. Lewis Nutrition Daily Brain Care. And is it available, on Amazon?
Yes, it's available on Amazon. It's available on our website. We are on all the typical social media channels under the Dr. Lewis Nutrition brand.
And is this for the prevention of Alzheimer's or the treatment, or both?
So I look at these polysaccharides as such an important tool in anyone's toolbox. I've been on this formula for over a decade. My mom's been on it for over 13 years. My children started taking it when they were 6 months of age. My wife started taking it when she was pregnant. So yes, I mean, I look at this as from literally cradle to grave because of how immunomodulatory and how potent these polysaccharides are. And you don't get them from food. So this
Now,
is why a supplement in this case,
did they lower the biomarker TAU, T-A-U?
we did not look at TAW in this particular clinical trial. We have so many other things that we want to study. And if I had, more money than I knew what to do with, I would have already been running more trials. But yes,
but you clearly saw the cognitive function changed. That improved.
Absolutely. The ADAS-Cog, this is not my opinion. The ADAS-Cog is considered the gold standard for assessing cognitive function in people, especially in people with dementia. So clinically and statistically significant improvements at 9 and 12 months. Unheard of.
I have a great interest. Sadly, my father died of severe Alzheimer's, and now my mother has it. So I have 2 out of 2 parents with it. So I'm definitely going to pick up some of this product. And
may I send you some?
What's that?
May I send?
That'd be wonderful. Just because we've got to do something. I don't think, and people with relatives with dementia, they'll know this. You're at a point of where I think it's still recoverable. I mean, my mom recognizes me. We can talk, what have you, but I see the forgetfulness. I see some of these things setting in. And my wife and I are talking. She was just a matter of time where my mom would have to go from independent living over to memory care. And boy, I'd love anything to intercept it. So I'm on it.
Wonderful. Well, I'm happy to help you guys any way that I can. And I can share with you our papers and.
Well, terrific. Yeah. Well, we've got to have another conversation on this. On the America Out Loud platform, Malcolm Out Loud and myself, we have a great interest in neurocognitive decline. I think honestly, we've got great advances in heart disease and cancer. And if you avoid heart disease and cancer, what a lot of people live out is the eventuality of neurocognitive decline. And every year, rates of people who are cognitively impaired go up. So here we go. Great need for these polysaccharides and products. So great to talk to you, Dr. John Lewis. You've basically helped us, I think, bring some balance back to this this argument or this debate. Many have joked they haven't seen a food pyramid since elementary school, but at least we're talking about nutrition.
That's right.
Give RFK some credit. At least we're talking about it.
Exactly. And just to be clear, I mean, he came to Miami a couple of times fundraising when he was still running for president. My wife and I went to those. We shook the man's hand. I mean, I don't know him like you do, but I'm certainly, I applaud him for asking all these questions about vaccines like you have and what needs to be done there. I wish he ran, as he ran on a platform of corporate capture of our government. And of course that was all mostly about pharma. But when you look at the folks that wrote these guidelines, and they're like almost all either connected to or funded by the cattle, pork, beef, Atkins associations or industries, you scratch your head and say, wait a minute, what happened here? Like the advisory committee wrote this 400-page document that had a lot of emphasis on eating plants, but yet the 9 people who wrote the final guidelines basically ignored it.
It's true. And plus no meetings. What about the American Dietetic Association, American Heart Association? Why not have some meetings, have an agenda, present some concepts and say, listen, here's some new data, identify the issues, drive consensus, and then write policy. That's good leadership. I've done that my whole career. And my great concern now is we're not seeing good leadership. So far, we went through several administrations, Trump 1.0, Biden, Trump 2.0. The leadership process is absent. Now it's, now it's policy by decree. We're going to have to leave it there. Dr. John Lewis, thank you so much for joining us on the program.
Thank you, Dr. McCullough.
Let's get real. Let's get loud. On America Out Loud Talk News, this is McCullough Report and Focal Point Substack. I'm Dr. Peter McCullough, your host. Thanks for watching.